Hi, I'm David Evans, and this is the first of what I hope to be a series of informal, not lectures, but discussions, which I'd like to call oMphaloskepsis. The first and premier episode of this set of blogs I'd like to make as a kind of an introduction. I have tried several times in the past couple of weeks to try to make this video blog, and every time I do that it comes off very stilted and very people will probably look at this and get turned off by my age and by my appearance and just out of act as I'm boring. However, I hope the subject matter that I'm thinking about putting out there won't be so boring. Whereas most people's blogs concern their activities of the day, what they're thinking, the fact that they went to the mall today and saw their friends, and therefore, or after the mall they went to get something to eat at Chick-fil-A, and then they went to McDonald's to play on the slides. That kind of thing is okay for some people, I suppose, but I don't really have a lot of use for it. I think that when it comes to, I think I'd like to do some more good with my video blog, and that involves giving back. What can you give back themselves? Well, I can give back some of my medical knowledge. I'm a 62-year-old retired radiologist, and during the 30 years that I've practiced, I picked up a smattering of, or maybe a little more than the average amount of medical knowledge. I've been told that I can interpret medical matters into lay language such that people can understand. Whenever doctors talk to patients, they frequently use big words that the patients don't understand. Patients are understandably to his wife or her husband, and they'll say, like, what did the doctor say? Well, I don't know. Use this big word. You're reluctant to ask their doctors to repeat it. They're very, very reluctant to have their doctor write it down, mainly because they feel the pressure that the doctor is sometimes under of having to get to the patient, and it doesn't have as much time as he would like to spend with you. So if your doctor comes in and tells you you have X disease and he will see you in 2 weeks, well, that doesn't really tell you a lot. What I would like to do is be able to kind of fill in the blanks. Whenever a doctor gives a patient a diagnosis, the patient is usually left in the blank or left in the dark as to what that means. You may come home and look up on the internet if you can remember how to spell it. Most likely you won't remember the context in which it's given. You will become frustrated and go off half-cocked about the knowledge that you've claimed, and he'll talk to his wife or her husband, and they'll say, like, what did the doctor say? Well, I don't know. Use this big word. And I think it was something like, well, you do oMphaloskepsis, something like that. I don't know. Of course, that doesn't mean anything to anybody. However, if I hear such a word, and I hear it in the context of what kind of symptoms you've got or what problems you have, then I can usually make a pretty good guess that he's talking about glomerulonephritis, which is a disease of the kidneys, and it generally involves an infection of the kidneys. It's a fairly serious disease, but it does have an easy treatment. As long as you take the proper medication and take the proper care of yourself, you will probably get over it. That's one of many examples that I can give you. So, one of the things I'd like you to do is just write me on the comments page, give me a video blog. If you want to make it private, that's okay with me. So somebody else doesn't watch it, especially if perhaps it contains something sexual or something that is personal that you don't want everybody in the world to watch on my video or YouTube. I hope this turns out to be the longest of the blogs that I present. I'd be interested in talking to you about anything that you're interested in. For example, if you want to talk about philosophy, get into that. If you want to talk about religion, or the lack thereof, get into that. Speaking of which, I don't have a religion, I'm not agnostic. And if that loses me much of my viewership, well, that's okay. At least you've listened to me so far. But if somebody is so close-minded that they don't listen to somebody else's opinion, that's their problem. In summary, this video blog is about you, about my reaction to what your questions and what your feelings and what your desires are. I like to be kind of a passive conduit. You ask me questions and I try to answer them. It doesn't mean that I'm infallible. It doesn't mean that I know all the answers. It doesn't mean that I'm smarter than anybody else. All it means is that I possibly have a little bit more experience and patience, and therefore may be able to fill in some gaps in your knowledge. I would prefer to just sit here and talk back and forth as much as the limitations of video blogging will allow. Anything you want to talk about, I'm willing to talk about, unless it's something that's so boring to me that I would fall asleep. Such as sports. I have noticed because I'm one of the few men in the country that does not watch Sunday afternoon football. So to wrap up this somewhat disjointed episode of oMphaloskepsis, if you notice how I've tried to avoid the use of contractions throughout this diatribe, that's sort of a very stilted language. I'm going to have to watch that, try to prevent myself from lecturing and act more like I'm talking to you directly. So that's one of the things I'm going to be working on for the next time. I hope to make these video blogs at least weekly and more often if necessary. And if you should happen to want to partake and want to participate by asking questions or by making statements and telling me that this is a wrong idea, that I'm fool for trying this, go ahead. I would like to think that I have a thickness and that I can take anything you can swing at me, especially since you can't find me and you can't physically attack me, I hope. I feel relatively impervious to your words. So, just see what kind of numbers of hits I get on this, if any. And likewise, we'll see if we get any kind of questions or any comments or people just telling me to get off the air. People telling me that this is a total waste of time. just go ahead and let me know, and we'll go from there. So, until next time.